This is Modern Dental Assisting, Chapter 46, Impression Materials and Techniques. This is part one of a two-part lecture. In this first lecture, we're going to be talking about the impression materials themselves. So impression materials are used to obtain an impression of the teeth and then also the surrounding oral tissues. We do have a couple of different techniques that we'll talk about in our next lecture, being traditional material-based impressions, and then also our newer, more modern digital impressions. Classification of material-based impressions includes our preliminary impressions, our final, and then also our occlusal, or they might also be known as our bite registration impressions. With our preliminary impressions, these are going to be taken either by the dentist or an AFTA, and we're going to use these for diagnostic models and cast, custom trays, provisional coverage, and then our orthodontic appliances. Our final impressions are going to be taken by the dentist or the AFTA or a registered dental assistant, and these are used to produce the most accurate reproduction of the teeth and the surrounding tissue, and we use these for our indirect restorations, partial or full dentures, and then our implant cases. The bite registration is going to be taken by the dentist or AFTA, and this is used to produce a reproduction of the occlusal relationship of the maxillary, so the upper and the lower teeth, when the mouth is occluded or teeth come together and mouth is closed. This is going to provide an accurate registration of the patient's centric relationship between the maxillary and mandibular arches. Impression trays are used to hold the impression material when the impression is taken. They might be rigid, and these are used to carry the impression material into the oral cavity, hold the material close to the teeth. We want to avoid any breaking while we're removing the impression, and it's also going to prevent warping once that impression is completed. There are two types of trays, or two basic types. We have our stock trays and then our custom trays. So with our stock trays, they do come in quadrant, section, or full arch, and then they can be perforated or smooth. They have different sizes, so they're comfortable and extend slightly beyond the teeth. If the size is incorrect, what we can do is use a little piece of utility wax to extend around the borders to make it more comfortable for our patients. Then we have the choice of custom trays. So these are going to be custom to that specific patient. What we would do is send some impressions to a laboratory, and from the diagnostic model, they will go ahead and create that custom tray, send it back to us so we can get a good impression that will fit comfortably for the patient. Tray adhesives are an option. Specific adhesives that are used with specific materials or impression materials are going to be our VPS adhesives, our rubber base adhesives, and then our silicone adhesives. We have hydrocolloid materials. These are used to obtain the preliminary and final impressions. Hydro meaning water and colloid meaning a gelatin substance. Depending on the type of hydrocolloid, the physical change from solution to solid can be irreversible. So this is changed by chemical factors, or reversible, and that would be changed by thermal factors. Irreversible hydrocolloid alginate hydrocolloid impression material that cannot return to the sol state after they become a gel. This is termed irreversible hydrocolloids. Alginate is the irreversible hydrocolloid that is most widely used for our preliminary impressions. The composition and chemistry of alginate is potassium alginate, calcium sulfide, trisodium phosphate, ditromechous earth, zinc oxide, and potassium titanium fluoride. The physical phases of alginate are the liquid or semi-liquid form, the semi-solid form, and then the gel strength of hydrocolloid is not as great as an elastomeric impression material. The strength and dimensional change of alginate. So the strength, it must be completely set before we remove it from the patient's mouth. The strength is going to increase over time, and we're going to want to leave it in the patient's mouth for the full recommended time. Some change can be caused by the environment. Inhib Inhibition is the water absorption that can cause the impression to expand, and then we also have syneresis. This is where open air storage can cause the impression, the alginate material to shrink. Packaging and storage of alginate. So the most common form, we have containers that are about the size of a coffee can. Pre-measured individual packs are more expensive, but they do save time because they eliminate the need for measuring of the powder. It will deteriorate very quickly if it's exposed to elevated temperatures or moisture, and the shelf life is about 1 year. Types of setting and altering setting times. So we have our normal set alginate, our fast set alginate. The working time is the time for mixing the alginate, and then setting time is going to be the time that's required for the chemical action to be completed. If we use a cooler than room temperature water, this is going to lengthen the setting time, and then warmer water will shorten the setting time. Water to powder ratio, we want to use accurate measuring. When we're using alginate, we always want to use the scoop from the manufacturer. For the adult mandibular impression, typically what we're going to do is 2 scoops of powder to 2 measures of water. And then for the maxillary, we typically do 3 scoops of powder to 3 measures of water. The most common technique for mixing alginate is going to be our manual spatulation. We'll use a rubber bowl and a beaver tail wide spatula. We do have the additional technique of the alginator, which is a rubber flexible bowl that's attached to an electronic component with a low or high speed. When taking an alginate impression, it's important for the EFTA to be able to mix the alginate, load the tray, and keep the patient comfortable while taking the impression. We're also going to want to explain the procedure to the patient and then be able to evaluate the alginate impression and look for voids. For the edentulous arch or the arch without teeth, this is going to differ a little bit with our alginate impression. So we're going to look at the height of the teeth and that are missing, and it's also important to include more extensive tissue details. So the edentulous tray is used to take this impression. This tray is not as deep as the other trays that we would use for a typical alginate impression in a patient who does have all their teeth. Reversible hydrocolloid is going to change its physical state from a sol to a gel and then back to a sol due to temperature. Hysteris is the term to describe the change in temperature that causes the transformation. We would use a special conditioning bath, and there are 3 compartments: the liquefying bath, the storage bath, and the tempering bath. The tray material is packed in plastic tubes. Each tube holds enough material to fill an arch and in the water-cooled tray. This needs enough viscosity to keep it from flowing out of the tray. Or we might have a syringe material, a plastic or glass cartridge. The syringes are preloaded or preformed, and the material must liquefy to be at a comfortable temperature. Application of reversible hydrocolloid impression material. So we would use a stock water-cooled tray. Plastic stops are going to be placed in the tray. The tubing is connected to the tray and to the water outlet for drainage. The material is liquefied and moved to the storage bath. The light-bodied material is placed in the syringe and the heavy-bodied is placed in the tray. The light-bodied material is expressed around the prep tooth, and then the dentist would seat the tray.